Hello friends, this is Dr. Siddharth Lakhani, consultant nephrologist and transplant physician at the Fortis SL Raheja Hospital, Mahim. Fortis has been doing a lot of, Raheja has been doing a lot of work. We did a lot of COVID work, a lot of good patients who have become salvaged, critical patients transferred from other COVID hospitals have we been able to salvage them, a lot of dialysis done for them. Now, slowly, everyone's believing that probably COVID is going down. So, hopefully, the next peak doesn't come. So, here also at Raheja, we have slowly started now, probably picking up the non COVID work also. Today, we are meeting basically more for discussion on something related to kidney. So, definitely, that will be my talk today. What we are discussing is probably how to prevent the progression of diabetic kidney disease. All of us will agree, slow and steadily, probably, that diabetes is probably growing day in, day out with stress, probably sedentary lifestyle, and a lot of uncontrolled sugars and obesity. Definitely, this is factors which are probably causing the diabetes to remain on a much higher side. And definitely, sugars are uncontrolled. Many a times, a lot of patients have metabolic syndromes with blood pressure, severe hypertriglyceridemia, and uh, cholesterols, and probably yes, uncontrolled sugar. So that is how 40% of this diabetes will usually develop some sort of kidney involvement. So it's important to realize once you develop an early diabetic kidney disease, there are parameters and steps to retard the progression of the disease, number one. And definitely there are factors which will prevent the patient going on to diabetic kidney disease as well. So both the parts are important. One is, of course, I would suggest anyone who's probably these days more than 25 should have the routine checkups. If you are probably feeling uneasy, you're having a family history, strong family history of diabetes and blood pressure, and if you are obese, definitely with central obesity, and of course, work and stress is there to everyone. So it may not be denied that someone is not having stress or someone is not having any sort of life pressures around. So it's important to know that when to check and when to go ahead for your testings. Once you're diagnosed, always see to it that you take adequate medicines, you're compliant to good diet, you have a regular checkup of your sugars, and a lot of us will believe that once you have sugar, you should always check other organs of your body. So you should go for a urine protein checkup, you should go for a kidney function checkup, you should always see for fatty livers or probably increase in liver enzymes, which will again tell us that probably yes, there is some sort of liver injury also going on. That is also important part. Coming towards now, once probably a patient diagnoses itself with a protein in urine or a probably high creatinine values, that is how the patients will be referred to us as a kidney doctors, and from there it will be an important part of patient's life. So usually diabetic kidney disease will be into two parts. The treatment will include, one will be preventing the further progression of disease, number one, and of course preventing all the other complications which are related to diabetes. So all of us, I think most of us will agree and probably will have some or the other family members with lot of diabetic related complications. So you'll have diabetic retinopathy, retina involvement or a posterior chamber involvement in diabetes. You will have diabetic nephropathy, protein in urine or an increased creatinine. You can have peripheral arterial disease, that's a wound or a non-healing ulcer. You can have neuropathy or a diabetic related nerves injury, which will have tingling, numbness, and probably unable to feel hot and cold, or probably slipping of chappals and poor control or probably poor sensations in the leg. And macrovascular or major organ involvements like cardiac or probably neurological involvements. So this is how a diabetic will have multiple complications to have. Now, once a patient probably, as we turn over towards our topic of preventing the progression of disease. So, once I see that someone is having diabetes, always check your blood pressures. Many a times it's missed. I don't have any symptoms, doctor. Why should I check my blood pressure? My blood pressure always remains around 140, 150. It is normal for me because I don't have symptoms. So normal blood pressure of 130 by 80. Anything above that on a recurrent checks more than 3 month period should be labeled as probably hypertension, and you should start adequate treatment for that. As I said, end organ changes. So all diabetics should be evaluated for eye, should have an ECG, baseline ECG, should have urine protein, uric acid levels, creatinine levels. So this will complete the list. Preventing the progression. So coming towards the kidney part of treatment, first important part is diet. Or once you're diagnosed with diabetes and blood pressure, probably you should strictly go on a low salt diet. Very important. So try to cut down your salt intake to probably less than 4 grams a day, which is very crucial, very important. Many a times, all of us, all patients will come and tell us in the clinic, sir, हम तो हमारे घर पे नमक यूज ही नहीं होता है. So you may have less salt in your food, but we consume a lot of other things like chivda, probably a lot of chaklis, chivdas, and all sort of fried foods which have a lot of salt and soda to make it. So that has to go down so that your salt intake is much lesser. Second important factor is low protein diet. So all meat eaters should cut down on their meat eating, more of meats like chicken or probably mutton should go down so that your protein intake goes down. If you're a veggie, pulses, all sort of pulses, dals should come down. Of course, you need a dietitian consultation of how much amount of protein according to your weight should go down. So that is important factor. Third important factor is definitely good control of blood pressure and sugar. Blood pressure target should be less than 130 by 80, and your sugars or HbA1c should be less than 6.5. That will be probably adequate for your parameters. Have a routine protein check. Probably if you are having severe albinuria, then you should go for 3 monthly checkups. There are medicines probably which your doctor will prescribe. ACE and ARBs, or probably drugs like telmisartan or losartan, olmesartan, valsartan. These are drugs which have been known to decrease protein and on a longer term prevent the progression of diabetic sort of kidney disease. So probably if you're not on medicines, you should see your doctor so that they'll prescribe you such medicines. A lot of patients don't have their urine protein checkups on a routine done, so prefer having a protein checkup done whenever possible so that we know whether you're not developing, because diabetic kidney disease is a silent disease. It doesn't give you any symptoms unless you have a lot of protein in urine and your creatinine starts increasing. That is when you have edema and a high blood pressure, and that is when you realize that okay, my kidneys have started malfunctioning. That is when you visit a doctor, and then probably at that time already the disease has progressed beyond stage 2 or stage 3. So chances of reversal becomes much lesser. So we say whenever there is high albuminuria or high albumin in urine with a raised creatinine, you have already developed irreversible damage to the kidney. Sugars on a higher term releases a lot of glycated products, and these glycated products go and affect your endothelium or the filter layers, and that is how they cause a lot of protein leak, and then slowly on a longer term you start progressing towards end stage renal disease or chronic kidney disease. So it's important to know that yes, we are on a diabetic thing, and we should always keep our diabetics well controlled so that you don't land up onto having any other kidney related problems. So coming towards these two things, third is of course check, always check for any other comorbidities. Fourth is on counter drugs. So a lot of patients have a habit of taking over the counter medical pills, painkillers, antibiotics. You go to the your local vendor and just tell him I have body ache, and they'll give you a prescription of diclofenac or something. So avoid any over the counter pills, consult your doctor, see to it that whatever symptoms are there, any small medicine which could affect your kidneys and probably your functioning of kidneys and on a longer term could lead to fast progression of disease. So we will not want any patient who is already diabetic and with already kidney disease to progress rapidly. So always avoid such things. So that is very important. So diet, good control of blood pressure, adequate medicines to prevent the progression of proteinuria. That is one important thing. Once you have a rise creatinine, always visit or ask your doctor to see probably a consultant nephrologist or a kidney specialist nearby so that you can know what is going on and how we should try to prevent this without causing any problems to other organs of the body also. And definitely once you have creatinine, there are multiple medicines which are available which prevents you from progressing probably from your stage 2 stage 3 towards end stage disease. So it's not like you have developed proteinuria. A lot of time patient comes with borderline creatinine and protein and says that my life is over now. So it's not like if you're diagnosed with diabetic kidney disease everything is over. There are methods which slows down the disease. It requires a combined efforts from the patient's family, and of course the treating doctor to get the disease slow so that the disease doesn't progress and we can prevent probably from patients going on to dialysis and treatment for end stage kidney disease. So always early is better. So don't avoid. Many times young diabetics they don't bother to come for 10 years. They don't check their sugars. So adequate control of sugar, first important parameter. Adequate control of blood pressure, second important parameter. Good diet, third important parameter. Fourth is no accessory medicines without any consultation. And definitely with this and a healthy lifestyle, no smokings, probably no alcohol, have a routine exercise, probably 15 to 30 minutes a day. Or you walk, you run, you jog, that's enough so that you don't put on the extra weight. If you're obese, try to cut down on your food intake so that you have adequate BMI for your weight. So that weight is an important factor, which again, obesity is an important factor, which again leads to progression of disease. Obesity has certain hormones which again goes and affects the kidneys in a similar fashion as diabetes does. So when you have all multiple parameters, it is known that one and the other they keep on joining and they keep on affecting the kidneys. So this is how probably we should on a longer term have a good way of controlling our diabetes. Diabetic is becoming probably the and India is becoming the capital for all these things. So unless taken care of, we are going to see a lot of complications related to diabetes, whether it is vascular, whether it is kidneys, whether it is eyes. So probably as a nephrologist, I request all of them, probably whosoever has diabetes, consult wherever you are, consult your doctor nearby, get your routine test done. Don't avoid early the diagnosis, slower the disease can be progressed. Early the diagnosis, the better it is. You start taking better care, and earlier it is, the longer it can be managed on medical management. So this is how probably I'll in my talk here. Thank you all so much. And as I already said, now probably COVID, non-COVID work has started everywhere. At Raj also, we are doing a lot of non-COVID work. It's not only in our COVID hospital. So probably anyone who's requiring any consultation related to kidney or probably any other thing can always come down. We are there here on a day-to-day basis to take care of all your diabetic complications. Raja is doing excellent work in diabetic related complications, all probably whether it's peripheral vascular, whether it is neurological, whether it is kidneys, a lot of specialist doctors available to take care of all sort of diabetic related work. So thank you so much. Thank you for patient hearing. Any questions we are available, you can always come down to us and we'll take care of you. Thank you so much.